But for children, like, it's actually, it's free care until 18. And even though it's free care, I can tell you, like, Pacifica families aren't accessing it even though it's free. You know, some do, but majority aren't, I would say. It's probably a big call to say majority, but I think that whether, I'm not quite sure what it is. I worry that sometimes it's an access to care because they're open sort of, 8:30. Yep.
And people are working 9 to 5.
Exactly.
Yeah.
So now what happens is you sort of, parents have to give permission for their children to be seen in a dental van, and the dental vans move around the schools, and they don't do any treatment. It's all checkups and preventative care. So that is a good service, and then you get something home to say that they might need follow-up in a clinic. The problem is you need to go to the clinic then, so often they're getting screened. Treatment is indicated or required, so something goes home, and then they're often not going to the treatment. And that's often, like we said, it's work hours, so often the parents are working. And the reason why I said it's, I think that change has probably compromised things a wee bit for that group that don't easily, can't get the time off work, is because we used to do dental care in the schools. So we used to do everything, like, so checkups, and they just used to be taken out of class and treatment done, and then it was sort of, parents gave permission, but it was a lot easier because most kids go to school.
At school,
Yes.
happening at school.
Yes.
So what year that ended?
Yeah, I would say around 2009.
Okay, because I, like, talking about this, I just have some very vague memories popping up in my head being at school and them actually, like,
Doing work. Yep. So there are some huge, huge positives to a lot of families with changing that, because kids were just getting treatment, and it wasn't necessarily changing things at home, with risks and, brushing techniques and dietary advice, just sort of checking in with parents. There was no opportunity to do that. So that was the sort of thought process to that change, and it's because the parent has to come, so it gives you a chance to kind of go, okay, are they brushing twice a day? You're just missing this area. Can you try this a wee bit different? Oh, there's a wee bit of decay there, and that way parents are actually informed and can actually. So there's positives and negatives, but I think it is a wee bit of a worry that they're not always attending the appointments for treatment. So I think there's a lot of work that could be done in that space. Usually parents have to take the children, usually after 2, around the age of 2, you're enrolled with the community dental service, and they are screened every year with their parent. So you can't really do much on a young kid, but it's good to just detect anything early, check that the parents don't have any questions, flag anything that could be done differently, and then so at age 4, then we have a bit of a chat with the parents just to say, okay, this is how it works when the kids go to school. The vans come round, it's checkups, it's preventative care. Do you give permission? As long as they give permission, then they're picked up in the vans when they go to school. Then they're seen till year 8, so form 2. And then when they're year 8, they are referred to a private dental practice of the family's choice, or sometimes we just refer to where close to their home. And then they are seen by a private dentist, and the private dentist receives government funding for that care. But again, sometimes people drop off in that transition because they may not have, something might have not quite connected with the private practitioner, or if the private practitioner can't contact the family, then they sort of just drop off the system till they represent. There's a lot of services in health that just aren't connected. No one really talks to each other or use their own IT systems and but so then they're seen until they turn 18, even though they might still be at school. It's the age of 18, which is a wee bit of a hiccup occasionally because kids sometimes represent later in the year, oh, I'm leaving school soon, but they're already 18, you know. So it is the care, it's free. I just think there's some issues around access, you know. And look, I'll be fair, some people don't always have the best experiences, you know. It's in anywhere you go, you're going to get some people that love their job and it shows, and others that are just get in there and do it, you know.
So